All right, so another test you can do is taking a look at the joint line tenderness. It's really similar to the palpations. You're just looking for any sort of pain or uh, any apprehension, the medial or lateral side of the joint line. And this is going to show you some sort of meniscal damage. Another one you can do is the bounce test. So you just have the athlete bend their knee to 90 degrees, and you're just going to straighten it out and look for any sort of a bounce in the knee as it extends. This can also elicit some pain as well, and that can be an indication of joint pain or meniscal damage. So another test you can do is Apley's test. So this, you're just going to keep the athlete at 90 degrees, and you're going to apply pressure from their lower leg right at their foot. And as you apply the pressure, that compression, you're gonna just do some twisting, some varus and valgus movements, and this pressure and that grinding motion should elicit some pain, and that can be an indication of a meniscal tear as well. All right, so then moving on to the MCL and the LCL. So we're testing for any sort of an MCL tear. We're gonna just apply a valgus force, and what that's going to do is stretch out the MCL, and any sort of indication of laxity or pain can be an indication of an MCL strain or an MCL tear. So you just keep your hand just above the kneecap and stabilize the thigh. Keep the leg about 20 degrees. And then just apply that valgus force. And LCL testing, same thing, but we're just applying a varus force. All right, everything's looking good. So we also want to look for some any sort of patella pathologies as well. So some special tests for the patella is patellar apprehension test. So what we're going to do here is move the patella we're going to move it laterally. So if the athlete shows any sort of apprehension to the movements, this is going to be an indication that there was patellar dislocation. As apprehension might say, like, they know what the pain feels like of their patella being dislocated laterally, and they don't want to feel that again. And so another test is the it's a patellar compression test. So what you do is just push the patellar down and move it laterally, medially. And a positive sign of this will elicit some pain, and that can be a sign of any sort of patellar strain, as well as possible patellar tear as well.